NEET PG 2026. How to study NEET PG 2026. So many things out there, so much of a content out there, but still the students are confused what to study. Now, as far as NEET PG 2026 is concerned, I will be just outlining you some of the important facts, how to prepare, the tips to prepare, the most frequently asked questions on the mind of the students as far as this examination is concerned. So, first of all, myself, Dr. Ash, who happens to be a guide, be a lecturer, be an educator for the students who just need a bit of an advice. And as far as this NEET PG examination is concerned, Now, I have shown you the slide, second slide, the NEET PG 2026 challenge. And is it a challenge? Yeah, really, it is a challenge. Why? Because more than 3 lakh students, increasing day by day, appear for this examination, which is a computer based examination, and there are almost 19 subjects which a student has to prepare, starting from anatomy, going to the medicine and medical subspecialties, going to the surgery and surgical subspecialties, going to the paraclinical branches like the microbiology, like the pharmacology, like the pathology, and then you have these minor subjects like orthopedics, dermatology, ENT, opto. So a student has to have a lot of things to go through, and how a student has to prepare. What are the difficulties which a student faces? So, what happens with a lot of matter around, with a lot many suggestion around, the students tend to be confused. But let me tell you one thing, that there are so many things which come on the mind of a student. So, what is the first thing? Is that you have to have a basic concept about the basic subjects. Anatomy, which is a major subject, physiology, biochemistry, pharma, forensic, social and preventive medicine. And I would just suggest you to go and have a combination. How you start? You start in a manner of allied and a basic subject. Say you take up anatomy, and then in association with anatomy, you just study surgery as well. So, an allied branch that makes it compact, that makes it integrated, and that's important. So, as far as the preparation is concerned, what is my role? What is my contribution? Now, you can see that I've just placed some important matter on the slide, and what I have come up with is something like Platinum Quebec, Volume 1, Volume 2, and Volume 3. Volume 1 is for the basic sciences, Volume 2 is for the clinical subjects, and Volume 3 is the image based of all the subjects which have been asked. The questions which have been placed in this series of books are the PYQs, the previous year's questions, the questions which are on the mind of an examiner, and more important than what you expect. So, a futuristic trend as well. What will be the types of questions which will be asked from you in the future examinations? So, what happens? These are high scoring books. This is a high quality content. This is one of the most, standard things which can help you in preparation of the NEET PG. So these things, and in addition to that, there are small booklets like for individual subjects, which are important subjects like pathology, and coming up with orthopedics, and coming up with foundation notes on the basic sciences. So that's all what you have to study. In addition to that, what this does, these are the high yield points, these are the PYQs, these are the highest yielding questions which have been placed over there. Now, for a NEET PG student, how do you plan your study journey? That's important. The important fact is that you have to fix a target, you have to have a goal, and the target you keep higher, the more, better will you perform. So, you have to have a target from, say, for example, 700 marks. You have to just have a target of achieving at least 680. Once you strive for the 680, you will get 650. Otherwise, if you keep a target of 500, you will be achieving something around in the range of 300, 350. So setting a high goal, a high ambition, high target is very important, and that will always help you. And for that, it is not only just setting a target, you have to work hard to achieve the target. That's very important, very, very important. Now, What happens then after that? You have to have a study timetable. It cannot be that the examination of NEET PG is and you give 3 months of preparation to yourself. No, it will not work that in such a competition. So you have to give yourself at least 7 to 8 months minimum, and that to 16 to 18 hours a day. That's how you get top positions and good merit. So you have to have a timetable, an organized, not a disorganized timetable for your NEET PG study. So you cannot study late, you cannot be having inconsistency, you have to be consistent in your studies. That's important. So a well organized timetable which is appropriate, which suits your, I mean to say, timings, that's important. Then you cannot do one thing, you cannot do injustice that you have studied and then in the end you will not revise. So revision is a very important thing, and that's where the NEET PGQR quick review comes into being. It is a compilation of all the facts which are there, which I have placed. So NEET PGQR along with Platinum Q Bank is what I guess is one of the best modalities of studying, not because it is my content, because the quality says that, the feedback from the students says so. So that's important. Now, effective study techniques. Now, coming back, so much internet, Instagram, YouTube. You do not study on YouTube, Instagram, and I mean to say these channels. You study at home. You study from the books. You study from high quality matter. And in this context, I will not go much about what there is. There is a lot of copy paste which is happening around these days. And eventually, I tell you, I have seen that students do well with a good revision strategy like NEET PGQR and a series of books like the Platinum Q Bank and uh, associated online MCQs, which will be coming ahead. And then, what is important? You have to have a good group of good academically oriented students, which always helps you discuss the problems among the students. It is not that you sit in the canteen and discuss things other than academics and waste a lot of time. So you have to be oriented in academically oriented groups. That's very important. Management. So as far as management is concerned, I told you, you have to keep a time. You cannot have an irregular time schedule. You cannot give 3 months to dermatology and leave 10 days for general medicine. So you have to have a knowledge of which are the major subjects from where the major chunk of questions are asked and which are more important. Everything is important. Don't underestimate any subspecialty. Don't underestimate minor subjects because each mark counts. So that is, and the introduction of negative marks, that's again problematic. So you cannot get questions wrong. You cannot get easy questions wrong. That decreases your merit a lot. So you have to have an effective time strategy, give good time to major subjects like anatomy, medicine, surgery, social and preventive medicine, pathology, and give appropriate time to dermatology, orthopedics, physiology, forensic, and many other subjects. So that is very important. Now, what happens during it's a long process, and during the course, you tend to get sometimes overwhelmed, you tend to get stressed, you tend to get burnout, and there is a negative feeling, lack of motivation, and there's a lot of pressure. So, what important is that the target you have set. Now, we have to achieve a target and keep the target fixed as the first thing. Second thing is that information overload, reading this book, this MCQs, that MCQs. It never helps. You have to recognize a certain, you have to take, you cannot read all the books, you cannot revise from all the applicable apps out there. So best is to take the standard textbooks, read the important topics from standard textbooks. Harrison, Nelson, I mean to say Das, Bailey, Schwartz, Sebston. They read the important topics from these books. They are very, very important. Robbins. So no book can substitute these books. That's important. Then stress and burnout. You have to give time to yourself to relax in between. You cannot continue for 10 hours at a stretch. So give breaks to yourself. Have that concentration, have that motivation, have that, I mean to say, strive in yourself and don't overstress yourself. Health is important. The first thing is health. Once the health is there, everything is there. So that's important. Then lack of motivation. Sometimes you get I mean to say, a test where you secure less marks, and that discourages you. No, take it as a, I mean to say, important step that yes, I have to work a bit more harder. Take it as a positive challenge. So there should not be anything which does not motivate you. So keep yourself highly motivated at most of the times. So as far as these things are concerned, they are very important from a student's perspective. I just tell you, these students, being myself a student, we have seen it in our times, and you have to just carry on. And in this context, I wish you best of luck in your career. In any case, any of you feels that you need to have any guidance, any issues, and I have given my email and my contact number over here, so you're always welcome to put up your queries to me, take up the time, and I will see. In case I am there available, I will be making it possible to be in touch with you. So you can just put in a mail, put up in a message. So that's how I can help. Thanks a lot.